Callahan from the Children's Hospital of Philadelphia, and I'm going to give a brief overview of PVS anatomy, normal and abnormal, which will hopefully help you fill out this particular section of the PVS registry. So I'm disclosing that I have no conflicts of interest, but I cannot draw, so you do your best. I did abbreviate a fair number of things, or there were already abbreviations in the cartoons that I grabbed, so go ahead and give this a screenshot and use it as your reference later. Okay, so the first part of this talk is going to discuss pulmonary veins with normal connections to the left atrium. So the pulmonary veins are supposed to bring back oxygen-rich blood from the lungs to the left atrium. And the most common pattern, or the normal, is having 4 veins, 2 from each side, drain the left atrium. The right middle typically joins the right upper and enters the left atrium, as does the left middle, or the lingula, joins the left upper and joins and then enters the left atrium. And here you have the right lower and the left lower. Probably the most common variant that we'll see is a left common. So a common vein is when all the veins from that lung are draining into that vein prior to coming into the left atrium. And so for this example, there's 2 right-sided veins, a right upper and a right lower, and then the left common, where the left upper and the left lower join together and then enter this common space. And this could be a long left common, or it could be a very short, but they enter their own single vein prior to entering the left atrium. The rest of the variants are more rare, and can be seen here is we already talked about the left common, but you can also have a right common, either in isolation, but usually if you have a right common, you have a left common. And then the right middle can really join anything. It could join the middle, it could join the upper, it could join the lower, or it could come in by itself, kind of like a trifurcation before entering this right common. But the rule remains the same, where the entire right lung is entering one single vein of variable lengths prior to draining it into the left atrium. We could have 5 veins where the right middle vein is entering the left atrium on its own. When this occurs, it can actually be 1 or 2 branches of the right middle draining into the left atrium. You could have 5 veins where the superior segment of the right lower is entering the left atrium on its own. I did not draw this, but there is a segment called the superior segment of the lower lobe in both the right lower and the left lower, and this normally joins the lower vein before entering the atrium, but this would be a unique pattern where it drains into the left atrium on its own. And I put in parentheses other here because that's what you would classify this as, an other vein. Similarly, the lingula could enter the left atrium on its own, and we don't have a designation for lingula, so this would also be characterized as an other vein. Or the superior segment of the left lower, which normally connects to the left lower, could enter the left atrium on its own, yielding you 5 pulmonary veins, and this would also be labeled as an other. Now, just to go through the major types of anomalous pulmonary vein connections. So if a vein is not connecting to the left atrium, it's connecting anonymously to another structure. The most common is what's typically called supracardiac, or some call it supradiaphragmatic anomalous pulmonary venous connection. or return. They both mean the same thing, just been a debate within the field, as there typically is a debate with morphology, and what to call things. But essentially what you have here is all the right pulmonary veins and all the left pulmonary veins joining behind the atrium into a confluence. And then instead of draining into the left atrium, it ascends in this vertical vein to the innominate vein, which then goes down the SVC into the right atrium. And after this was repaired, where they connect the confluence to the left atrium, this is where you might actually see a right common and a left common, depending on how far out they went with their anastomosis to the left atrium. So this is supracardiac. So if you can have supracardiac, you can definitely have infracardiac or infradiaphragmatic, because it goes below the diaphragm. So here you see all the right-sided veins and the left-side pulmonary veins joined together behind the heart, and then they drain down the descending vertical vein, typically into the portal system. There's some variance, but for the purpose of this diagram, we enter the portal vein, which then eventually makes its way back to the IVC once it gets through the liver and through hepatic veins. Okay, how about intracardiac? And so instead of the veins draining into the left atrium, they're actually draining into the coronary sinus, which drains into the right atrium. This is known as intracardiac total anomalous pulmonary venous connection. And then you can have mixed, where the veins go to different places. And in this example, all the left veins ascend via this vertical vein into the innominate, and the right-sided veins connect into the right atrium. So this is a mixed variant of total anomalous pulmonary venous connection. Now, if some of the veins connect to the left atrium, but some of them don't, then we call this partial anomalous pulmonary venous connections, or PAPVC. In this example, we have 4 veins connecting to the left atrium, but one, the right upper, is connected to the SVC. You could have the right upper and the right middle connect to the SVC, or even all the veins on the right side. This situation is just one, the right upper to the SVC. This is a common variant where you have just the left upper connecting to the innominate, anomalously to the innominate vein and not the left atrium. When you have the right-sided pulmonary veins connecting to the IVC, typically below the diaphragm, as well as the heart being shifted to the right as a result of right lung hypoplasia, this is called scimitar syndrome. And this typically drains the entire right lung, and so it's a right common vein, and it can also be called the scimitar vein. But this is a form of PAPVC. Now that is the quick review of normal and abnormal pulmonary venous connections. If you have any questions, feel free to send me an email. Thank you very much for your time.